Hello, everybody. Welcome back. Another episode of the COVID-19 Chronicles. So I'm gonna kind of keep this short and simple. So some of the things I'll talk about is, I guess I'll talk about them right now. Texas reverse reopening. Yes, there's a spike in Texas. If you look right here, there's been a huge spike. Let me actually scroll down to the Texas numbers here, or the top numbers here. You see Texas has moved up 5,000, over 5,000 cases reported recently. So not very good for me since I live in Texas. Another thing is masks are starting to be required where I live in my county and also Harris County. So masks are required in, I think, businesses or even in public places. Either way, I've been wearing one, and I don't mind because I'm taking this very serious. And also where I live on top of that, which is Fort Bend County, which I'll go over, is new cases, a new high for new cases. Very concerning. I do think a lot of it is the young, mainly because if I look down here, let's go scroll down further. You'll see the total cases. I mean, I think it was the 26. The 26 was 45,000, over 45,000. The 27th, June of 27th, was 42, over 42,000. But the death, I realize the death lag a little bit, but you're looking at the death is very low. It's actually shrinking, except for the 25th, June 25th. It actually was over 2,000. I don't know why. Maybe all of a sudden people passed away on that particular day. But anyways, so the numbers are increasing. Let me see if I can get a chart or graph here. If there is a graph, where's the graph? Okay, here's the graph. So yeah, you see the shutdown happening, right? The initial spike in infections, and you see the shutdown. And this is the summer, and this is the period where they're starting to reopen. And right about here, around this time right here, is the protest rioting and looting, and then you have this spike in cases. Now, are they related? Are the protesting, the rise in coronavirus related? I think they are related, but also in combination of openings, reopenings, social interaction. I do, when I go out there and I'm wearing my mask and everything and my buff and my N95 mask, and on top of that surgical mask, I mean, I'm just my face is covered. The thing is, you want to protect your face because those are the areas of, your eyes, your nose, your mouth, which you will get infected. All right, touching things, you're not going to get infected by touching contaminated surface, as when you touch your hands to your face or you inhale someone's cough, right, or breath, is when you'll get infected. So that's concerning. And if you think about what was happening during the protest, people were close together, maybe not wearing masks, shouting, close interaction. It makes sense that young people are carriers, most likely carriers of this COVID-19. They are most likely being the most infected, but at the same time, they are most likely to be asymptomatic or the most pre-symptomatic and not actually get hospitalized. And then they're going back to wherever they're from, or going back to their home, infecting others, or inadvertently infecting other people because they don't know that they're infected. And so that's where you're getting, possibly that's where you might be getting the spread. Like, you got to consider, is it a coincidence that you had a lot of protest in combination of reopening, a lot of protest, right? And now you have this huge spike going up. I don't think so. It's not a coincidence. And so there you go. So let me just go into the numbers here. Let's just go. So over 2.5 million confirmed cases, 42,000, over 42,000 since yesterday, which would have been Sunday or Saturday, June 27th. I'm recording this in the morning, 10:27 a.m., June 28th, 2020. 500 deaths as of yesterday, but over 125,000 death total. And so you're actually seeing this graph here peak up a little bit. And look at this, numbers increasing. I really think this is correlated with protests and riots along with the opening. But we'll get into a little bit, and you can see areas here. So Texas is big, Florida is large, over 9,000. Georgia, Arizona, you see these large places. North Carolina. Now, are these places where they had a lot of protests? Maybe, maybe. Let me go into the local Texas map. 244 counties out of 254, only 10 more counties, and all of Texas is pretty much infected. There's like barely one, two, three, four. I mean, barely any that are not affected, but I think they'll get infected. The thing that I wanted to show here was why is this not working? Anyways, let me see here. This graph right here, the age demographics, definitely 20 to 59, but this is really starting to increase, especially 30 to 49. Before it would be in the upper range here. Now you're seeing the lower range of 20 to 40 really increase. So I think young people are, in fact, spreading the disease, and they're not going to be as symptomatic because they have a better immune system, I believe. And so that's what you're seeing here. And I live in 77459. It's increasing, has the most 420 confirmed cases. It is the most in my county. It's always been the most, so I am always wearing a mask, always wearing gloves. And here's what I really wanted to show you. So I have a 7-day trending based upon, I think, doctor visits. I think this is doctor visits. And if you look here, let me see, this is, okay, so this is where I am, Fort Bend County. Doctor visits due to COVID-19 like symptoms. This was the height of the first wave. You see the shutdown, the summer reopening, and now look at this. Doctor visits are going through the roof. So that tells me that something's going on. And here's the map. The red spots are the increase in doctor visits. So you're seeing a lot of increase. Again, it could be reopening and increase social interaction. It could also be protest. All right, increase in protest. Again, social interaction, increase in social interaction. And so these combination of things are increasing. And in my opinion, the protests did make a difference. Although you probably don't see areas where there were protests where, you know, if you look at this, it's not necessarily 100% true, because if you look at this, some areas where there seem to be a lot of protests aren't have any increases. But then again, you have to realize a lot of these protests, people are not from that area. They are from outside that area going to an area protesting. And once they leave, they go back to wherever they're from, spreading the coronavirus. That's what I think is really happening. That's why, you know, you see Minneapolis or Minnesota, you're probably saying, well, where's the increase in the cases? You don't see it there because I do believe a lot of people from outside the state went there, protest. Once the protests were done, they went back to wherever they're from and spread the coronavirus. That's what I think really happened. And now we get to the IMHE numbers here. And if you look here, they're expecting an increase. As a matter of fact, there's easing mask projections. And so if you wear a mask, this green line shows, this is Texas right here, shows that if you wore a mask, it would stay steady. If the easing continued, it would increase along with projections with the recent data. So this is skyrocketing right now. It is going to lead to a second wave. We're not in the second wave. We're just in the continuation of the first wave. I think the second wave will really hit, as you see here, daily deaths as they project. Probably September, it'll start skyrocketing. All right, the infections and death will start skyrocketing. If you wear a mask, on this green line, it will go down. You see it right here. Of course, I don't know what this purple line is. I think they messed up. Hospitalizations. And social distancing will decrease or increase, or no, social distancing will decrease. Social interaction will increase as time goes on. So you're going to expect to see a second wave coming very, very soon. Probably in the winter, in my opinion. Anyways, I'm going to conclude this episode. Please like, share, comment. Until next time, bye-bye.